Podcast 2 of the Thorax series, the intercostal space, the diaphragm and respiration. This podcast is going to detail the contents of the intercostal spaces, including the intercostal muscles, the intercostal nerves and vessels, and also the diaphragm. The podcast will finish by detailing the mechanisms of breathing. So the thoracic cage contains 11 pairs of intercostal spaces, with each space being named after the rib which forms its superior border. So for example, the fifth intercostal space is formed by the fifth rib superiorly and the sixth rib inferiorly. Now let's detail the contents of these spaces. Within each intercostal space, there are 3 layers of intercostal muscles, an intercostal nerve, and a posterior and anterior intercostal artery and vein. The intercostal nerves are the anterior rami of the thoracic spinal nerves T1 to T11. The 12th thoracic spinal nerve is known as the subcostal nerve, and this is found in the subcostal space, which is a region lying inferior to the 12th rib. As these intercostal nerves are somatic, they contain both motor and sensory branches, and these supply the 3 layers of intercostal muscles, the parietal pleura deep to each of the intercostal spaces, and also the skin that overlies the intercostal spaces via cutaneous branches. Running alongside the intercostal nerves in each of the intercostal spaces are the anterior and posterior intercostal arteries and veins. The posterior intercostal arteries arise directly from the descending or the thoracic aorta and run alongside the costal groove of the corresponding rib. The anterior intercostal arteries arise from the paired internal thoracic arteries, and in some circumstances these arteries anastomose to form a collateral circulation around the intercostal spaces, linking the internal thoracic arteries to the descending aorta. We will return to this collateral circulation in podcast 10 when we detail coarctation of the aorta. So also in the intercostal spaces are the intercostal veins, and these run alongside the intercostal nerves and artery alongside the costal groove. These veins form a similar pattern, with the posterior intercostal veins draining into the azygous system of veins which lies against the posterior thoracic wall, and the anterior intercostal veins draining into the paired internal thoracic vein. I'll revisit this arrangement throughout this series when we look at the posterior mediastinum. So before I detail the musculature of the intercostal spaces, it's important to appreciate that there are numerous muscles of respiration that are responsible for either elevating or depressing the ribs. Some of these muscles, like pectoralis major, pectoralis minor, and serratus anterior, are known as accessory muscles of respiration, and these won't be described here. But if you are interested in their anatomy, then you should listen to podcast 4 in the upper limb series. So there are 3 layers of muscles in each intercostal space. From superficial to deep, there is external intercostal, internal intercostal, and finally innermost intercostal. All of these muscles run from the lower border of the superior rib to the upper border of the inferior rib, and have their fibres running in a specific direction. So most superficially, the fibres of external intercostal run downwards and forwards. This layer of muscle extends from the vertebral bodies posteriorly within the intercostal space and extends to the sternum anteriorly. Most anteriorly, this muscle is replaced by the external intercostal membrane. So external intercostal runs downwards and forwards and is most prominent posteriorly within the space. Deep to external intercostal is internal intercostal. Its fibres run at a 90 degrees angle to the external intercostal, and therefore these fibres run downwards and backwards. This layer of muscle extends from the sternum anteriorly, and as it extends to the posterior aspect, is replaced by internal intercostal membrane. So internal intercostal runs downwards and backwards, and is most prominent anteriorly within each of the intercostal spaces. Deep to internal intercostal is the final layer of muscle, and this is the innermost intercostals. This is an incomplete layer that is comprised of 3 muscles that line the inside of the thoracic wall. Innermost intercostal is found most laterally, with subcostal muscle found posteriorly and transverse thoracis anteriorly. Running between these 2 deepest layers of muscles, so the internal and innermost intercostal muscles, is the neurovascular bundle, which, as I said, contains the intercostal nerves, arteries and veins. All of these muscles within the intercostal spaces are supplied by the intercostal nerves. Okay, so now let's finish the podcast by detailing the mechanisms of breathing. To do this, we first need to consider the diaphragm. So the diaphragm is a double-domed musculotendinous structure that separates the thoracic and abdominal cavities. It is formed by muscular peripheral parts which converge centrally as a tough central tendon, and this resembles a trampoline. The 2 domes of the diaphragm form a convex superior surface, with the right dome sitting slightly higher than the left due to the liver. At the diaphragm's peripheral margin, it slopes sharply inferiorly between the diaphragm and the thoracic wall, and this region is known as the costodiaphragmatic recess. The diaphragm's muscular portion can be divided into 3 parts, according to its attachment sites. There is the sternal part, the costal part, and the lumbar part. The sternal part comes from the posterior surface of the xiphoid process, the costal part comes from the internal surface of the inferior 6 costal cartilages, and the lumbar part comes from the superior 3 lumbar vertebrae, so L1, 2 and 3. The lumbar part of the diaphragm is composed of the left and right crura. These musculotendinous bundles extend superiorly from the lumbar vertebra to the central tendon and form both the aortic and esophageal hiatuses. These hiatuses are apertures in the diaphragm that allow the aorta and esophagus to pass from the thoracic cavity into the abdominal cavity. The aortic hiatus is present at the level of the 12th thoracic vertebra, whilst the esophageal hiatus is present at the level of the 10th thoracic vertebra. A third aperture exists in the central tendon of the diaphragm, and this is the carval opening. This allows the inferior vena cava to ascend through the diaphragm and join the right atrium. This opening is present at the level of the 8th thoracic vertebra. The diaphragm is the chief muscle of inspiration, and during quiet breathing, contraction of the diaphragm causes the central tendon to descend, and this increases the intrathoracic volume, allowing air to be drawn into the lungs. For expiration, the diaphragm relaxes, which decreases the intrathoracic volume and allows the lungs' stretched elastic tissue to recoil, and this expels the air. This process continues cyclically under the control of the 2 phrenic nerves which innervate the diaphragm. Alongside the elevation and depression of the diaphragm, the intercostal muscles are involved in increasing and decreasing the volume of the intrathoracic cavity by moving the ribs. During forced inspiration, contraction of the external intercostal muscles causes the superior 6 costotransverse joints to rotate, and this elevates the distal end of the ribs and moves the sternum anteriorly. This movement resembles a pump handle action. The 7th to 10th costotransverse joints undergo gliding movements with contraction of external intercostal muscle, and this elevates the ribs, causing them to move laterally, and this movement resembles a bucket handle action. These 2 movements, the sternum anteriorly and the ribs laterally, increases both the anteroposterior and transverse diameters of the thoracic cavity, increasing its volume. This allows an increased influx of air into the lungs. These 2 movements, the sternum anteriorly and the ribs laterally, increases both the anteroposterior and transverse diameters of the thoracic cavity, increasing its volume and allowing an increased influx of air to enter the lungs. With forced expiration, internal intercostal muscle reduces both the anteroposterior and transverse diameters of the thoracic cavity by reversing these movements. This muscle, alongside innermost intercostal, depresses the ribs and reduces the intrathoracic volume and expels the air from within the lungs. So in summary, each of the 11 pairs of intercostal spaces contain 3 layers of intercostal muscles and a neurovascular bundle which contains the intercostal nerves, arteries and veins. The diaphragm separates the thoracic and abdominal cavities, and along with the intercostal muscles is involved in respiration. In the next podcast, number 3, we will enter the thoracic cavity and detail the pleura.